Well, I had in 2005, I had 3 miscarriages in a row, all very early miscarriages, and I had started to have tests on the NHS to find out if there was a reason why, and I wanted to sort of do something positive while I was waiting to have these tests, and I'd read a lot about acupuncture being used for IVF patients and having a lot of success, and also for people who weren't conceiving for whatever reason. I mean, I had never had any problem getting pregnant, but it was staying pregnant that was the problem. I started coming in May, and by September I was pregnant again, and I continued seeing him throughout my pregnancy. In fact, I even had an appointment for the Friday of the week that she was born, because she was born 5 weeks prematurely. So I think, so what's that, about 4 or 5 months between sort of starting to see him and getting pregnant and staying pregnant this time as well. The emotional support that he gave as well, I mean, obviously it was working in my body because, you know, it all happened and we had a successful pregnancy this time. But it was more the emotional support. You know, he was always so positive that we would get there eventually. And at the start of my pregnancy, I had some bleeding as well at 6 weeks, and just thought, it's not happening again. But he, you know, he was really positive, and I also had was given a high risk assessment when I had my nuchal scan for Down syndrome as well, and the hospital wanted me to, or said to me, you can have an amnio to, you know, test whether the baby definitely has Down syndrome. And again, he was just, and I was umming and ahhing about it, but really didn't want to have it because there is a miscarriage risk. And again, Terry was just really positive and said, no, I'm sure everything's fine, and everything was fine, of course. So it was just nice as well to kind of have somebody to come and talk to about it, because, you know, you talk to your family and friends, but you kind of don't want it to sort of overtake your life. So you try and, you know, live a normal life as well. But just to come and have, you know, half an hour every week just to sort of chat about it. And so the emotional support was really important as well. I mean, I try and, I mean, there's so many people out there with different fertility issues, and I do try when I meet people and say, you know, have you considered acupuncture? Because I do think it's something that people just don't sort of think of. You know, they always go down the sort of Western medical route rather than looking at sort of, you know, Chinese medicine and acupuncture. And I just think, I just wish I'd seen him earlier, to be honest. And I would like to have another one. And to be honest, when we're planning to have another, I'll come and see him and just, you know, see him for a few months just to sort of give myself the best possible chance.